Hi, my name is Jessica Nunez, and I'm filming a video for GI, Neuro, and Muscular for Module 7 for credit. And today I have my friend here, Stephen, who is going to be my model. Stephen, do you give me consent to do the exam on you?
Yes.
Okay, great. And so I'm going to go over and do the assessment on his skin. So he has a very good color distribution. There's no cyanosis or diaphoresis noted on his skin, his appearance as well. And he looks very alert. And can you tell me where you are today?
Sure. Montclair, New Jersey.
Okay, and can you tell me today's date?
So it's March 18th, 2025.
Okay, great. So the patient is oriented, alert, times 4. And now we're going to go into abdomen, where I'm going to be doing inspection. We're going to be assessing for peristalsis and distension. So here, I don't see any distension, but I am noticing that he's got a little bit of a protrusion here. It looks like an abdominal hernia. So any pain with your stomach?
No.
Okay, great. So what I'm going to do is I'll get started with auscultating the abdomen. We're going to start with right lower quadrant. Okay, he's got no more active sounds. Right upper quadrant. Left upper quadrant. No more active sounds. And left lower quadrant. Okay, he's got no more active sounds. Great. So now he's going to go now into, we're going to auscultate now vascular sounds. So here's the aorta, here is renal arteries, and down here's iliac. So we're going to go into aortic sounds. Renal artery. There's no bruit or swishing sounds, which is normal. Okay, that's normal. Normal findings, no bruit or swishing sounds. I'm going to go into iliac artery. Very normal, no swishing or bruit sounds. And normal, no bruit or swishing sounds. And now I'm going to go into percussing all quadrants. Okay, so over here sounds tympanic. As I'm coming up on the liver, it sounds dull. Okay, we'll start again. Okay, that's the liver right there. Let me come up a little bit. So the liver is about 4 centimeters in length and 3 centimeters in height. Percussing. This is the spleen over here. Sounds tympanic, so that's a normal finding. Okay, everything is tympanic except for the liver, which is dull, which is considered normal. And then I'm going to go into light palpation. So before I go into light palpation, I don't see anything pulsating, which is a good indication that there's no aortic aneurysms happening. So this way we don't run the risk of injuring the patient or causing any untimely incidents. How does that feel? Is that comfortable?
Gotcha.
Okay, so we're just going to gently palpate. Okay, and I'm going to go into deep palpation. Okay, are you okay?
Okay.
Great. So we're doing deep palpation. Palpating the aorta, there's no issues. We do know that this is a hernia, abdominal hernia. So we're going to palpate. Okay, so we're going to palpate now the liver. Skeletal, and we're going to be inspecting the clavicles and the scapula, trapezius muscle, anterior deltoid. Everything looks good. Coming down, checking the elbows, and then we're going to go right into range of motion and strength for neck. So I'm going to have you bring your neck down to your chin, all the way down, and you're going to lean it back. You're going to do ear side to side, to your shoulders, side to side. And then now I'm just going to assess for strength. You're going to press against me here, press against me here. You're going to go ahead, press on the opposite side, go. Okay, so range of motion is 5 out of 5. And now we're going to do your shoulders. So now you're going to bring your shoulders up into the air. Okay, and you're gonna bring it all the way down, tuck it to the back. Okay, range of motion is good. And then you're gonna bring it in front of you, palms facing up. And then I'm gonna have you bring that, bend it towards you, extend it. And then as I'm pulling on it, you're gonna resist. So I'm gonna need you to pull back this way, pull this way, and then resist me, great. And then I'm gonna go ahead and extend, and you're going to resist. So that's 5 out of 5 for range of motion. And now we're gonna check into reflexes. So we're going to do reflexes right now. We're gonna do biceps, brachioradialis, and triceps. So just gonna have you relax for me. Okay, that's a +2. And then we're gonna go into brachioradialis, +2. And then you're just gonna do a hinge movement for me. +2 for triceps. And we're gonna go on the other side too. We're gonna repeat the test. +2. And brachioradialis. +2, and then you're going to hinge for me. +2 on the triceps. And now we're going to continue to move down and palpating. We're going to check for radial pulse and brachial pulse. I'm going to do it on both here. He's got +2 on both. And +2 for radial, +2 on brachial. And now we're going to inspect your hands. So we see that his hands have good pink color, no cyanosis, good capillary refill of +2. No inflammation, no redness, no joint discomfort. And now you're going to do range of motion. You're going to bring your hands down like this, and you're going to extend them up. You're going to bring them in. You're going to bring them out. And now you're going to resist me. Okay, and you're going to resist me. Okay, so range of motion is 5 out of 5. And now we'll go into hips. So now we're going to go into hip assessment, and here we're going to check for joint. How's your hip feel?
That's fine.
Great. There's no swelling, no redness, no pain, any pain?
No.
Great, okay. And what I can do is I can have you shift to the other side, please. And then I'm checking Stephen's hips here. There's no edema, no swelling, no hip discomfort. Everything seems to be comfortable for him. And now we're going to be checking for lower extremities. Okay, there's no edema noted around the ankles, no swelling around the knees. Okay. All right, so for feet, all right, we're going to go here. And then I'm going to have him turn around. I'm going to have you sit up for me. Can we pause that? Great, so now we're going to do range of motion. So Stephen, we're going to do hips, full range of motion. So you're going to step forward for me one step, and you're going to raise your leg, bring it back, move it side to side, and okay, great. And then you're going to do it for the other leg, bring it forward, bring it back, side to side, and you can cross over in front of you, cross over in front of you. So that is a full range of motion, 5 out of 5. So you're going to come here so I can assess the lower extremities, ankles, and feet. And so now with the feet, as we said before, there's no edema, there's no swelling around the ankles. And now we're going to check for range of motion. And now what he's going to do is, I'm going to have you bring your feet forward, bring them towards me, and bring them away from me. Okay, you're going to flex them, and you're going to bring them back. Okay, great. So it's 5 out of 5 for strength. And you're also going to flex them on your own, and bring them in, bring them out. Okay, great. And now we're going to check for pulses. So we're going to do dorsalis, both, dorsalis pedis, +2, tibialis, +2, tibialis, +2. And I'm going to check for reflexes. So I'm going to test your Achilles, and it's going to feel a little tender. So it's +2, and here, +2. And now we're going to do for plantar reflex. I'm just going to have you raise your foot for me. And you're going to, so that's a negative Babinski sign, which is ideal. Had it been positive, the patient has an indication of MS, but this is a normal finding. And we're going to go into spine. I'm going to assess for his back, his spinal. So we're checking The spine is in alignment. There's no scoliosis or lordosis, and muscles are a good even distribution. So Stephen, I'm just going to have you go back to the back over there, and then you're going to bend forward, touch your toes. Okay, and then you're going to reach back. You're going to extend backwards. Okay, great. And now you're going to tap side to side, side to side, side to side. Okay, great. So range of motion for spine is 5 out of 5. And now we're going to be seated. I'm going to have you sit down. So now we're going to be doing rapid assessment, rapid alternating movements. You're going to put your hands here, and you're going to be alternating very quickly. Okay, great. And that's ideal. So rapid alternating movements. Can you please run your heel across your hip like this? And do the other one. Okay, great. And now we're going to be checking for exteroceptive sensation, which means you're going to be able to detect if there's any superficial pain whatsoever. I am going to have you close your eyes though, okay? And you can relax. So, can you tell me what you feel here?
Sharp pain right arm. Sharp pain left arm. Dull pain right. Dull left.
Dull pain left, right?
That's correct.
Okay, great. So we're going to do that, and then now we're going to check for temperature. I'm going to have you rotate your hands up with your eyes still closed. Can you tell me the temperature of this?
That's cold.
Okay. And I'm going to have you check the temperature of this.
Yeah, that's hot.
Okay, great. And then now we're going to do, I'm just going to have you check one more time here.
It's dull. Oh,
Till right.
dull right. Yeah, that's correct. Dull left.
Great, thank you. And then now we're going to do proprioception. So you're going to determine motion. So I'm going to have you bring your hands down to your, and you're going to tell me what we're doing. Is this up or down, okay?
That's up. Down. Up. Down. Up. It's down. Down. Up.
Great, thank you. And then now we're going to go into vibratory, which means you're going to let me know if you feel any sensation and when it stops, okay?
Yes. Stop.
Great,
Yes. Stop.
great,
Yes. Stop.
great. You know?
Yes. Stop.
Great, awesome. So we did vibratory. Now we're going to go into cortical sensation, and that means he's going to identify stereognosis and identify shape. So you're going to have your eyes closed and give me one of your hands. And can you tell me what you have here?
Coin.
Okay. And can you tell me what you have here?
Pen.
Great, thank you. And now we're going to go into graphesthesia. So we're going to tell me what you feel here.
It's a C.
Great. And what about here?
That's a 3.
Yes, excellent. So that is graphesthesia. Now we're going to go into 2-point discrimination.
Okay.
All right, you're going to keep your eyes closed. Can you feel that?
Yes.
Great.
2.
Okay, great. Do you feel that?
1. Yes.
Okay, great. So now I'm going to do extinction. Do you feel that?
Both arms. Yes.
Okay, and I'm going to release it.
Right arm only.
Okay, great. Thank you. So now we're going to go into standing, and I'm going to have you walk to the back. And you can pause it. So now we're going into the standing component of the neurological exam. So now we're going back, focusing back on Steve. Steve, you're going to stand, observe standing. You're going to walk towards me, and you're going to walk backwards. And now, as you're walking, you're going to walk on your heels now. And then you're going to walk backwards on your heels. Then you're going to walk tippy toes and tippy toe backwards. And then we're going to alternate between heel to toe. Heel, toe, heel, toe, heel, toe, heel, toe, going backwards, heel, toe, heel, toe, heel, toe, heel, toe. And now we're going to go into romper. So that means you're going to step back, come this way. Okay, now you're going to stop right there, close your eyes. Patient has very good overall balance, means he's testing for negative for any cerebral issues. He's got a good sense of balance, and failure to be positive can indicate the patient has multiple sclerosis. So now we're going to have Stephen put your arms up in front of you, with your arms closed, your eyes closed, and then if his arms were drifting, it's called pronator drift, it would indicate that this patient has cerebrovascular incident, which he does not, because he's actually testing negative, which is actually a very good finding. And that concludes our examination. Dr. Marlon, muchas gracias por todo. My leg thanks you as well. We thank you, and we enjoy this course. Thank you.